Welcome to the information session for the Diagnostic Medical Sonography program here at Augusta Technical College. So I'm Christy Flowers. I'm the program director, and this is for anyone who is applying to the program, or if you're just wanting more information about the program that we offer or the career itself. So just to go through a little about myself, I graduated in 2006 from the Medical College of Georgia. So I do have a Bachelor's of Science in Diagnostic Medical Sonography. So I learned general sonography, obstetrics and gynecology, along with echocardiography and vascular, and then got to choose kind of what area of sonography I wanted to go into. The difference between the bachelor's degree now and the associate's degree that we offer is you have to choose what area of sonography you want to go into before you start the program. So we're going to go into a little more of that. But I started first of all at Trinity Hospital, which was general ultrasound, which is kind of call and as needed work, weekends, holidays, nights, or when somebody was off. My first full-time job when I graduated was at Augusta University, which was a large academic medical center. I did high-risk obstetrics and gynecology there, and I went from there to Dr. Deborah Ware's office, which is a private practice that does high-risk obstetrics, and I still do work for her on the weekends. And I went from there to here and starting the program. So a sonographer is a professional who is part of a healthcare team. So we possess knowledge and skills, and we're able to use that knowledge to produce diagnostic images for physicians. We use our machine and our probe to look at different anatomy within the body to create images for the physician. So the sonographer does provide basic nursing and medical care and will assist with emergency treatment of patients if it is indicated the patient needs it. Just to note that once you complete a program like this and you take your registry exam and pass it, you are considered a registered diagnostic medical sonographer, and that is something that is recognized nationally. So it's not something that you have to do from state to state. It's actually recognized all across the world. So even if you chose to do a travel job and travel around the world, you wouldn't have to get new certifications generally. So we use specialized equipment that produces images with high frequency sound waves. So yes, we use sound waves. We do not use any type of radiation. And then the images that we get assist the physician in making a diagnosis for our patient. So the basic specialties are general and OBGYN, vascular, and then echocardiography. So the program that I am over, Diagnostic Medical Sonography, is going to cover general and OBGYN, and that breaks down into some further subcategories that we're going to discuss. But Augusta Tech also has a vascular and an echocardiography program. So I am not over those two programs. Elizabeth Frails is over those programs, and they are, again, at Augusta Tech. We do all of the admission and tuition, etc. through us. If you want more information, my contact information is at the end. Feel free to email me or ask questions whenever you respond back to the questions if you are applying for the program and you're watching and responding that way. But I can give you her contact information. If you want to apply to more than one sonography program, you definitely can do that, but you will need to attend an information session also for vascular or echocardiography that you're going to also apply for. So what do? Well, we are members of a healthcare team. So we're a piece of the puzzle. We have a patient who has an abnormal lab value or a symptom, a pain, a mass that's felt on a physical exam, and they order an ultrasound to get more information. So we do get to work with all age groups from infants up to elderly. We get to work with all types of patients, those that are healthy and can walk in by themselves, get on the bed by themselves, to those that may be critically ill in the hospital, maybe in ICU, intubated, things like that. We get to use new and advancing technology. Now that technology does always change, so we have to be able to be adaptable and switch it up whenever we need to, working on new machines or getting new equipment, getting new computer programs in the hospitals, things like that. Analyzing a patient's symptoms and their lab work, and then knowing how to adjust an exam based on the patient's needs. Another thing that is big for us is that we are the eyes for the physician. So most of the time we are not going to have a doctor looking over our shoulder and watching us take these images. We're going to go in the room, we're going to get the images, and then we're going to send them over to the physician. If the physician doesn't see something and ask us to take additional images, then if we haven't taken images of a pathology in someone's, say, gallbladder, then that's missed. The patient doesn't know they have it, and they go home and think that they had a normal ultrasound. So it is very important that we pay attention to detail, that we look for these subtle changes in anatomy. Our machines do not take a picture of everything within the abdomen. We choose where our probe stops. We choose where we freeze and we take a picture. So if there is pathology there and we skip over it, it is missed. So this is a big deal for us. And if you're looking at pay and comparing pay for sonographers to some other imaging modalities, this is one of the reasons we get paid a little more, is because we have a little more of a responsibility. So once we do that exam, we then provide an oral or a written summary to the physician. Also, typed, most everything now is on the computers, so doing some type of report to the physician, helping to receive patients from the waiting room, scheduling patients, assisting with office and clerical work. If you are in a smaller office or a smaller clinic, you may have to help with scheduling and office and clerical work. If you're in a large radiology department, you may not. So that may depend on where you work. Providing basic patient care, blood pressure, pulse, respirations, temperature. We do teach all of that in the program, but again, if you're in a larger clinic or a larger hospital versus a smaller clinic, some smaller clinics, you may be asked to do some of those things. And then providing emergency medical care if the situation arises. Everyone, once they get into the program, is required to be CPR certified. So if for some reason, that situation was to arise, a patient was to code, then it would be our responsibility to help the patient. So where do we typically work? Well, more than half of sonographers are going to be employed by hospitals. They're going to have large radiology departments that are going to house a lot of sonographers. Physicians' offices also employ sonographers. The ones in our area mostly are the OB offices that have sonographers that will do the OB ultrasounds, but some other physicians' offices also have sonographers. Imaging centers, so they are like, you can go there just to get your ultrasound, your mammogram, your CT, your x-ray. They will employ sonographers. We have traveling ultrasound companies, so they give you temporary assignments. It could be 6 weeks, it could be 6 months, or somewhere in between there, or longer. But you get paid really well, and basically you're just doing this temporary shift. You get to travel. They pay you a stipend to travel. They'll give you housing allowance, those kind of things. And then ultrasound equipment companies. So these are the equipment companies that are, the sonographers will actually do the sales for the ultrasound machines and then do training on the machines once they're delivered. So they employ sonographers to do both of those. Now, traveling and working with the equipment companies, you usually have to have at least a year of experience plus to start to move into those positions. So schedules are going to depend on where you work also. So again, more than half of sonographers are going to be in those hospitals. Those are the radiology departments, and they're going to have coverage 24 hours a day. So our local hospitals do have second and third shifts where they have someone who is in the hospital at all times. But if for any reason the hospital does not have that shift available, someone has to be on call. Okay, so someone would leave, say, at 5 in the afternoon, and then there would be an on-call basis from, say, 5 p.m. to maybe 7 or 8 a.m. the next morning. So this would be for emergent things coming through the ER, things like that. So it will vary as to what is needed, but we do have to provide 24-hour coverage. So ultrasound is always available, whether it's on call or someone in the hospital all the time. Private doctor's office, like those OB offices that I mentioned, are generally going to offer an 8-hour day, no call. However, those imaging centers that are outpatient and not nights and weekends are not going to be as available. Those positions are not going to be as available as those in the hospitals. Okay, so when you first get out, I want you have to be open to understanding that you may have to work nights, weekends, those kind of things. Okay. Some of the imaging centers in our areas do offer some additional hours or like half a day on Saturdays for people who don't want to take off work to come to their appointments. So that's opportunities too. So based on a study that was specifically done in Georgia, the average salary for sonographer was $63,320, which is $29.96 per hour, and that's based on 40 hours of work per week. So according to the U.S. Department of Labor, there is an expected increase in new sonographer jobs of about 19,000. And there has been a significant increase just over the last, I would say, 8 to 10 years. There's been a big increase in our area and how many sonographers are employed by hospitals. I will say, so $29.96 per hour, that's going to be, an average of brand new sonographers and those who have been doing it for 20 years. So, but I do feel like that's a decent average for our area. Most of our students are going to get offered 25 to 27 coming right out of school. And then, of course, they will climb that ladder as they get more experience, get additional registries, those kind of things. So I do have a few videos. I'm hoping you can hear this okay. I'm going to play it. There may be an ad.
Sonographers are an elite group of medical professionals who use ultrasound technology to see the body's organs, tissues, blood vessels, and musculature. Sonographers are on the front line in the early detection and evaluation of high-risk pregnancies, women's health issues, cancers, heart defects, and arterial blockages. The sonographer uses their knowledge of anatomy, physiology, and physics to place a small device called a transducer against the skin in the area to be imaged. The transducer sends high-frequency sound waves into the body, which are bounced off internal structures in the body. After the sonographer makes the necessary adjustments on the ultrasound machine, a computer analyzes the reflected sound waves and creates an image of the structure. But unlike X-rays, no radiation is used. Sonographers can specialize and be certified in scanning different areas of the body. Abdominal sonography captures images of the abdominal cavity. OBGYN sonography focuses on women's health issues, including pregnancy. Musculoskeletal sonography concentrates on muscles, ligaments, tendons, and joints. Cardiac sonography evaluates the heart and its blood flow. Vascular sonography evaluates the blood flow of peripheral and abdominal blood vessels. And breast sonography confirms the presence of cysts and tumors. Sonographers work closely with physicians and care providers to diagnose disease and are employed by hospitals, physicians' offices, walk-in clinics, and medical and diagnostic labs. It's an exciting and challenging career with tremendous opportunity. The Bureau of Labor Statistics predicts employment growth of about 26% between now and 2024, which is more than most professions. The median base hourly wage for sonographers is $34 per hour, which is over $70,000 per year based on a 40-hour work week. Sound interesting? The Society of Diagnostic Medical Sonography is an excellent resource to help you learn more about becoming a sonographer, getting certified, continuing your education in...
All right, so those numbers that they quote are national. So if you choose to work somewhere other than Georgia, you may make a little more money than you will in Georgia. But those are national averages. So some traits and characteristics we feel are important. So compassion is a big one. So our patients a lot of times come to us and they are not at their best. Either they don't feel good, they're scared, they're worried, they're upset. And so sometimes we don't get their best side, but we have to be compassionate about what they're going through. We have to be good at learning new technology and equipment. I mentioned, about the machines. We have a certain machine in our lab, but that is not the same machine you're going to use when you go out into the clinical sites. The buttons are similar. They're basically called the same thing. They may not be in the same spot. So just being able to learn new technology and adapt to new equipment, including computers. So everything now is on the computer, right? So with looking up our images, checking the patient's chart, doing our report for the doctor, everything is on the computer. Excellent hand-eye coordination. So we do scan with our right hand in general and OB, and we manipulate the machine with our left hand. So having good hand-eye coordination to be able to manipulate the probe in small, very tiny movements with our hands. Being detail-oriented, I mentioned being the eyes for the physician. This goes back to that. So again, knowing our protocols and exactly what images we have to take, knowing what normal looks like, so that when we see abnormal or pathology, we can adjust our images and get what we need on the patient. Concentrating in busy environments and handling stressful situations kind of go hand in hand. We have a schedule when we walk in the morning, and we also have ER patients and we have inpatients, and we asked Miss Jones to sit back in the waiting room because she was here for her transabdominal pelvic and her bladder wasn't full, and now the front desk is calling saying she's really, really got to go and we need to get her back on the table. So you have to figure out how to juggle all of that, know that you have a team of people to get it done, but we don't have this nice little pretty schedule with no add-ons and everything go perfect for our day. That's just not how sonography goes. Enjoying learning. Our career is always changing and advancing. We also have to have continuing education credit hours. We have to have 30 every 3 years. So that's going to be, going to a conference or doing some virtual type seminars and tests afterward. Things like that for you to keep abreast on the newest advancements in the career. And also being strong in anatomy, physiology, and physics. So anatomy is what we look at every day. Physiology is understanding a disease process and then understanding how that affects our image and what that makes the organs look like. on the scan if we know a patient has a certain disease, what does that mean our ultrasound is going to look like? And then physics is what drives our machine. So if you've taken conceptual physics in preparation for getting ready for the program, ultrasound physics is much, much different than that. But it is what drives our machine and what creates the image on our machine. So we dive really deep into that. Technical requirements, so being able to communicate well with patients and others. I like to bring this up because we have had students in the past who just don't like to talk to people. And that is okay if that is you, if you are an introvert and you don't like talking. But if you know that about yourself, start working on it now. You have to talk to other sonographers, you have to talk to your patient, you have to talk to radiologists or the OB physicians, which sometimes can be intimidating, right? But if you know that about yourself, know that you're going to have to come out of that shell and push forward. So start working on it now. Performing sonographic tasks for 8 to 12 hours. You will be standing a lot of that time. So 8 to 12 hours, because depending on the shift that you get assigned, you may be in an 8-hour shift or you may be in a 12-hour shift. And a lot of times, even if the sonographer has a chair, sometimes you won't have a chair as the student standing behind them watching until it's your turn to scan. So being able to lift 50 pounds or more routinely goes along with assisting moving patients. So we're not just going to make you heave ho and move 50 pounds, but assisting in moving a patient from their hospital bed to an imaging table or to a stretcher, or from a wheelchair onto your imaging table. You may have to assist with movements or assist a nurse with moving a patient on the floor. Being able to move, manipulate, and operate our equipment. So we do a lot of exams portable, meaning that we take our equipment, we push it down the halls of the hospital and go to the patient who's maybe not stable enough or can't easily come to our department. We do work in very dim lighted rooms for long periods of time. So this can put a strain on someone even that has good vision. So it is important that you understand that. We do have to look at a computer screen a lot of our day. Prepare and use materials for procedures, so sterile trays, instruments, linens, patient care items, having steady hands to be able to drop those for the doctor. We do have to assist physicians during invasive procedures like amnios or biopsies. So I do have students that come to me, right, and they say, well, I like sonography, or I'm interested in sonography because you don't have to deal with blood or needles or anything gross like that. Well, that is not the case. I honestly cannot tell you a single area of sonography where you will not be in invasive procedures, doing procedures with needles, where you will see blood, where you will see something that may be considered gross to you. So if you have more questions about that, please let me know. But just know there's a lot of procedures that we assist with in sonography. And then also performing ultrasounds during surgery and at bedside. So there was many times I had to go to the OR to assist the physician, or maybe they were closing the patient up and they wanted to make sure blood flow was adequate, or if they do, surgeries while a patient's pregnant and they want to make sure that the baby is okay after the surgery, those kind of things. So again, a lot of areas of sonography where you will have to go into the OR. Adequate vision, hearing, and touch. So we have to be able to see color variations within our images, the different shades of gray and the different colors in the color flow Doppler. Being able to hear audible sounds. So when we do Doppler, and you can actually hear that, and we have to be able to hear that and understand, recognizing changes in that. Using both hands, wrists, and shoulders. Again, we scan with our right hand. We use the machine with our left, but we do always have to use both hands, both arms, both shoulders. Performing basic maintenance equipments and checks on the machines, and then physical and emotional support for our patients, because again, sometimes we don't see them at their best. We should always be at our best. And sometimes, they may not be happy to see us. So we've got to be able to provide that support when needed. So some things that you'll need to get into the program. So first one is observation. Observation is not a requirement, but it is recommended if you're not sure if sonography is for you, or if you're not sure which area of sonography is for you. So do you like general and OB better, or is echo or vascular going to be a better fit for you? So it is sometimes a lot of hoops to jump through to be able to get in to do some observation. I know one of the only hospitals locally that will let you do it is Doctors Hospital. They actually have a whole department set up for this, but they will give you 1 8-hour day. Now you can split that day up into a few hours, different days, but they'll only give you 8 hours to observe. And so you can observe in different departments and kind of learn more about the specific areas. So it is a competitive admissions program. So to be considered for admission, you have to complete all of the required prerequisite courses, which is on our guided pathway, and please refer back to that or ask me for a copy if you are not familiar. All those courses have to be completed, and you have to have at least a 2.75 GPA on that. Now, if you have taken classes that are not on our required prerequisite list, they will not be factored into this 2.75. So if you've taken, I don't know, culinary classes or anything that is not on that list, it's not factored in. So only those classes on the list are factored into that 2.75. If there is any natural science course, for our purposes, that is anatomy and physiology or physics, that is older than 5 years at the time you're applying for the program, then it has to be retaken. And any course that is retaken to get a higher grade, we will then use the highest grade. So for instance, if you made a C in your AMP1 and you retake it and you get an A, then we only look at the A. We used to take these and like average the C and the A together, but now we just take the highest grade that you make. Okay, now ranking for the program is based on these classes listed here. So college algebra, statistics, anatomy and physiology 1 with lab, anatomy and physiology 2 with lab, and then conceptual physics with lab. So those classes lumped together, you're then given a ranking GPA, and then that is put into the system. It is required that you attend the information session. And again, if you are doing this information session currently for program admission, you do need to email me back answering the questions. And if you don't have the questions, email me and ask for them. We do accept 10 students each year. That is based on our clinical site availability. I know people ask me a lot, why only 10? It is based on how many clinical sites we have available within our area. Another note is that medical terminology is not on our required prerequisite list. But if you have not taken the class before you enter the program, there is an additional textbook that you'll purchase and a different additional test that you will do. We do offer medical terminology on campus and online, like even through the summer. So if you're interested in taking that through the college and getting that out of the way, I definitely recommend that, especially if you are looking for something to fill some of your time this summer. If you've taken it, and I have proof in DegreeWorks that you've taken it for the college, then you will just get a 100 for those tests that are required for anyone that has taken it. So admissions process. Now, if you are a student somewhere else, before you can apply for the program, you do have to officially be a student at Augusta Tech. So you have to fill out the application and get all of your transcripts sent over, complete that whole application process before you can apply for the program. So if you're just starting out, you will apply to the college, get accepted to the college, sign up for your prerequisite classes, and then if you're taking courses elsewhere, you have to get your final transcripts sent over. So even if you've sent one initially for admission to the college, once you finish your last class before you actually apply, then you have to send that final transcript over so they have proof that you've taken all the classes. So in the spring semester, which is where we're at right now, that you're done with your prereqs, you will submit a competitive admissions application to be ranked for the program that you choose. So there is a application for each program, and if you are choosing to apply to more than one program, you have to fill out more than one application. Ranking applications are available or were available March 1st, and they are due this year by May 24th. You have to complete all the steps on that ranking application. Don't check something off if you're not sure if you've completed that. Please take a moment to check into that before you just check it off and submit it. Some things I want you to consider before applying to the program. The program takes a lot of commitment, time, energy, and sacrifice. It is not easy, and we say this every year, and as students definitely disregard us saying this, but again, it is not easy. It is not meant to be easy. We are in life or death situations. We are identifying pathology that could change a patient's whole course of care, or decide that it's cancer versus not cancer. There are so many things that our ultrasounds can tell, and it is a lot of information. It is a very rigorous course, but it is worth it. We get to see our graduates out in the field working and happy and enjoying life and enjoying their career and learning more and more, and it's great. So it's worth it, but it's not easy, guys. If you do progress to the sonography classes, they are full-time. So you don't have an option to do night or weekend or part-time. So the schedule is set for you, and you do full-time daytime classes. Students will be asked to sign a consent form to be scanned during class time or lab time. So we have 5 machines in our lab. We have 10 students, so one person is the patient while one person is the sonographer, and then after a certain amount of time we will switch off. So we only do scans on each other that are what I consider not sensitive exams. So we'll talk more about this, but we only scan the abdomen, the neck, the arms, the legs. We don't scan breast, scrotal, or transvaginals in lab on each other. So clinical rotations are every semester. The sites are located in Augusta, Evans, Aiken, and Thompson. There are additional sites that we use occasionally if the student is closer to a different area. Like for instance, we have used Jefferson Hospital in Louisville, or we've used St. Mary's up near Madison or Greensboro. So if you're closer to one of those areas, or you think you may want to get a job at one of those, we can always look into getting sites, but you can't do all your clinicals there. You would maybe do one clinical towards the end of the program. Clinical rotations are either 8 or 12 hours, depending on your assignment. Understand that you have to be flexible with your schedule. Okay, so you may have an 8-hour rotation for 5 weeks, but then it will switch to a 12-hour rotation for the next one. We don't pick and choose who we give those to, so just understand that you've just got to be flexible. I also want to add on to that if you have children, little ones at home, please be mindful that you have got to set up to have backup childcare. You've got to have a support system in place. I recently had to have a student that had to drop out because she was not feeling well. Her son was getting sick a lot, and it wasn't really anything she could have controlled. Both her and her backup plan had to have surgery. So, but I just say that to say I don't want anyone to underestimate how much time it's going to take. You will be occupied. You will have to have not only good childcare, but someone maybe to pick your child up from the daycare, things like that. So just be mindful, reach out if you have questions about scheduling, any of that. Students have to be able to perform all those technical requirements we talked about, and also right before that, traveling to and from those clinical sites is your responsibility. We are also in a profession where we have to listen to, receive, and then improve based on constructive criticism. So I've had a lot of students in the past that just really get stuck on this because they really hate having somebody tell them they're doing something wrong. But that is how we learn in sonography. You're going to come into lab and you're going to get a picture of the liver in the first couple weeks, and myself and Miss Milburn, who also is one of the instructors, are going to say, oh no, this is not good. Let's talk about how you would do it better. Let's talk about what we need to see in the picture versus what we are seeing in the picture. And then you're going to continue to try to do it and continue to try to do it better. The same thing's going to happen at your clinical sites. You're going to get some images and they're going to tell you, nope, that's not great. Or maybe they do tell you it's good, but that usually doesn't happen until you are a few weeks or months into the program and you start doing things correctly. So understand, constructive criticism, being told you're doing something wrong, and how to improve it is how we learn in sonography. Protocols and procedures are also a big part of sonography. So when we sit down to scan that liver, we have an exact protocol of exactly what images we need to show the doctor in a certain order, in a certain way. And so every organ you sit down to scan is like that. So there's not a lot of being creative or open to different images. This is what it is. You have to follow those set rules and a lot of authority. So a physics registry and a specialty registry have to be completed for you to be considered a registered diagnostic medical sonographer. Now you take your physics registry the second semester you're with us. You take your specialty registry in either abdomen or OB, or both if you choose, the last semester that you're with us. And that when you pass both of those, that earns you the RDMS credential. Know that clinical situations can be high stress environments. Students have to be able to maintain a high level of professionalism. Musculoskeletal work-related injuries are also not uncommon in sonographers. So we practice proper ergonomics. We actually test you on proper ergonomics, how to sit at your machine, how to hold your probe, how far your arms should be from your body, a neutral position for your spine. This wasn't something that was even mentioned when I went through school in 2006, but it is something that we discuss now in hopes that we are going to prevent some of these injuries that do happen to elbows, shoulders, backs, necks within our field. We're also in a service field. We're there to help our patients, but sometimes we do put ourselves at risk. So there may be times that you get exposed to blood or other infectious material, or I don't know, COVID, it could be HIV, it could be hepatitis, it could be the flu. We do practice standard precautions, but I cannot take away that risk of a patient coming in that is sick and coughing on you or something getting on you, etc. So just be mindful of that. Sonographers are in high demand, but understand jobs are competitive, right? You do compete with everyone that is in your cohort or in your class for those jobs. We haven't had an issue yet of anybody getting a job that wanted a job. It has worked out really well, and the biggest job interview that you have is your clinical visits, your clinical assignments, where you get to go out and show them your work ethic and how well or how much you care about the career. To mention this again, sonographers are a part of a lot of sensitive exams. So again, transvaginal exams, where the probe goes into the vagina, scrotal exams on males, and then breast exams on women or on males, but most of those are done on women, are those that we consider more sensitive. Now, these are scans that everyone that is in the program has to prove competency on and complete. So I've had before, right, males come up to me and say, well, I mean, I don't plan on doing transvaginal scans, so I don't want to comp on that. But you don't have that choice. If you're in the program, you have to comp and do all the different types of exams and prove proficiency in them. Again, we also don't practice those on each other. We have, and we'll talk about them in a little bit, simulators or our phantoms, which are like our scanning dummies that we practice those sensitive exams on. So we do have to do a criminal background check and a drug screen before students can get placed in their clinical assignments. So once you get into the program, you will be asked to initiate a criminal background check and drug screen. So if anything does come up on one of those that would prevent you from having clinical placement, then you would not be able to continue in the program. Okay, so also there are the ARDMS, who you sit for your registry exams through, will also run a background check before they will approve you to take your exam and become registered. So again, that could prevent you from ever getting registered if you do get through the program. So we have had times where we have run a background check early and submitted it to clinical sites to see if something that may be on a student's record would prevent them from placement. So again, you could reach out if there is something that you feel like it may be on your record that may prevent this, and you could pay early and get this submitted and see if there would be anyone who would not accept you. So definitely reach out if that's an issue. Here's another video.
And 1-800
of course, an ad.
Contact makes it so easy to renew your prescription or order new contact.
They live among us. Their morning routines are just like ours.
Toddler!
But when they go to work, something changes. It shows up on the mammogram, but I can't be sure if it's serious.
Got it.
It's benign.
Hi, Mrs. Perez. How are you today? Running around like crazy. Right after this, I have to return one of the 2 car seats I got at my baby shower. And then I have to pick up my son from daycare. He's so excited about being a big brother.
Mrs. Perez,
Yes?
you're gonna want to hang on to that extra car seat. All day long, their amazing skills, knowledge, and insight give doctors and patients the images they need. They are sonographers.
All right, so we don't always feel like superheroes, but our profession is super important. All right, so some general program information. So it is an Associates of Applied Science. It is 4 semesters that are, again, are mapped out for you. Once you get into the actual sonography classes, you can complete those prerequisite courses in whatever time frame you want to. They just have to be done by the end of the spring semester that you are applying for the program. The program, Diagnostic Medical Sonography program, covers general sonography, obstetrics and gynecology, small parts, pediatrics, invasive procedures, and then we do an introduction to vascular sonography. So you remember Augusta Tech also has a full vascular sonography program. So we do not cover everything. We cover some of the exams that radiology departments want employees to be able to do without having to send them all the way to a vascular department to have it done. Our program is accredited through KHEP, which is through the JRC DMS. So what that means is they make sure that you as a student are getting everything from us that you should, that your clinical sites are adequate, that we are teaching you everything that we should be. We do studies each year to look at everything, along with visits every 5 years to review this. So I won't read all of this, but our program again is accredited in abdomen and obstetrics and gynecology. So our goal is to prepare entry-level sonographers within the field of diagnostic medical sonography. It is so that we can meet the need in our community. We do have a large medical community here in Augusta. To assist students in developing effective verbal and written communication, appropriate training to develop critical thinking and problem solving in all aspects of the career, to promote professionalism and work ethics, to provide guidance and to develop lifelong learning, and to prepare students to take the registry in abdomen and obstetrics and gynecology. Very similar here with our learning outcomes. This is kind of just focusing in on what you're focusing on. So showing satisfactory verbal and written communication, review and evaluate patient history and symptoms, and provide an adequate exam, analyze images that we acquire during our exam, prepare a written or electronic report, and present these findings to a physician, display professionalism in all aspects of the career, and display acceptable work ethics to be an asset to our healthcare community. So now to dive into some of the areas that our program covers. So again, you all have heard of obstetrics and gynecology, right? These precious baby pictures over here that everybody brings home from their OB appointment. So yes, obstetrics is a huge part of what sonography is, but these cute baby pictures, right, are just this little tiny part of what actually happens when we are scanning. So looking at everything on a baby from head to toe, all the parts of the brain, the abdomen, all the organs, making sure the limbs, the fingers, the toes, everything on mom is forming and working correctly. So there's so much more for OB that you don't realize your sonographer is doing when they're doing your scan. Up here, I mentioned transvaginal sonography. So this is actually a non-pregnant uterus. So this would be on a woman who's maybe having pain or abnormal bleeding, abnormal cycles. So this, again, the probe is inserted into the vagina so that we can look up close at the uterus and the ovaries and tell if something's going on. So down here, an introduction to vascular. So this is a carotid artery scan, and this is a lower extremity venous scan. So again, we teach those two exams along with some abdominal Dopplers that you need to know to work in a radiology department. Over here is abdomen. So these are all soft tissue organs that we can look at within the abdomen. This is a gallbladder here with a gallstone. Up here, this is a kidney, and all the color is showing blood flow within the kidney. This is a liver. Right here is a pancreas. And then right here is a spleen. So these are all organs that we routinely look at when we're doing exams on the abdomen. So neurosonology and pediatrics is a part of sonography that we teach. So this is actually neonatal brain. So babies that are born prematurely have a risk of developing bleeds within the brain. So we will do these studies in the neonatal ICU to make sure babies don't have a bleed. And if they do have a bleed, then we want to make sure medications are preventing it from getting worse. We also do hips, spines, pyloric stenosis, appendix, all of those on pediatric patients. So over here is small parts. So this is a thyroid exam here, thyroid gland in the neck. This is actually a cyst in the breast, and this is a scrotal exam. So those three areas are considered small parts. So invasive procedures, I mentioned, needles being a part of sonography. So amniocentesis up here. So generally the sonographer would hold the probe and guide for the physician when the physician would put the needle into the abdomen and into the fluid where the baby is at. So this is placenta. This is the uterus. We can see the needle coming in right here, and the baby's over here. So our goal is to show the doctor a pocket of fluid that is away from the baby, away from the placenta, away from the cord, so that they can insert the needle and get the fluid to get the cells that they need to send to the lab. Over here is a breast biopsy. So again, generally the sonographer would hold the probe and guide for the physician. The physician would put the needle and needle guide in. If this was the mass here that we were trying to get the sample of, this is the needle coming in. We're guiding for the physician, and we're trying to show them so they can get a centralized section or portion of this mass to send to pathology. Down here is a paracentesis, so you can see the difference here in this patient's abdomen. So different disease processes, whether it be cirrhosis or hepatitis or cancer, there's other things too, can cause this overproduction of fluid within the abdomen, which makes a patient very uncomfortable. So again, if this is what we see on our screen, the black is fluid and we're trying to drain that fluid. So we want to show the doctor a nice pocket that's away from the bowel, away from any other organs. And then again, the needle is inserted here by the physician. We guide for them, and then they will drain this fluid in the abdomen. So we do have small class sizes. I mentioned that we just have 10 students that we accept. There are 2 instructors, myself and Miss Milburn, that both are in lab and both teach to give you a lot of one-on-one time. We are committed to your success. I have had graduates from our program that have scanned myself, have scanned my son. And so, yes, we want to know that you know what you're doing, and our success is definitely your success. Our scanning lab, so we are at Piedmont Somerville in their professional building is where our classroom is at. And then next door to us is a hospital, and our lab is in the hospital. So we have part of a wing of a hospital. So we have 5 different machines, 5 different scanning stations, which is the machine, an imaging table, and an ergonomic chair. Our machines do have 3D 4D capabilities. We do have transabdominal and transvaginal simulators, which again simulate those transvaginal scanning, along with simulating a lot of pathologies that we learn in class that we don't normally see on each other in lab. We also have those phantoms, or the scanning dummies, which we sit on the table and we scan them with the probe just like we scan a person. We have one for transvaginal, one for neonatal head, one for a second trimester OB, a thyroid, a breast, and a scrotal. Now, our students take courses in abdominal, pelvic, vascular, obstetrics, and pediatrics and small parts scanning and anatomy. There is more lab time built into those classes for hands-on learning than there is lecture time. Sonography, physics, sectional anatomy, and specialized procedures are also taught. We do have 2 registry review preparation classes. We do a physics review in the 2nd semester, and we do an OB and abdomen registry review in the 4th semester. There's 4 clinical classes, so you start clinic the 6th week of the program from the very beginning. That helps you gain confidence and improve your scanning skills in real life scenarios. We do have a wide variety of clinical settings. So we have small hospitals, we have large hospitals, we have imaging centers, we have physicians' offices. So you kind of get to see all the different areas of sonography too. Now, expenses and responsibilities. So this is the most up-to-date numbers that I have. But again, you can email me and I can give you an Excel spreadsheet that we provide the students that get in if you need that to get any kind of funding or help in place, or just get money together. So books for the program this past year were $782. Now the majority of that is in the 1st semester. The books that you buy the 1st semester do carry you throughout the program. Besides having to buy some registry review books for physics and for abdomen and OB, the majority of the books are going to be the first semester. We do recommend 4 sets of uniform scrubs. However, you're only in clinic 2 days a week in the beginning of the program, actually 2 days a week for the first 2 semesters. So if you would like to just have 2 sets and then purchase more later, or when you're in clinic 4 days a week during the summer, if you just want to wash them, that's fine too. We recommend 4 just when you get into clinic 4 days a week. You will have to have general school supplies, of course, whatever you need to keep yourself organized. A jump drive or a thumb drive, so you will scan in lab and then you will have to submit those images into Blackboard. So you will use the jump drive to put your images onto the jump drive and then upload them into a PowerPoint and onto Blackboard. Liability coverage is $6 per semester. That is added to any allied health class, so that'll be added to your tuition. Your criminal background check and drug screen is approximately $100. I think this past year it was around $98. If for any reason the drug test is a retest is warranted, meaning it says it's diluted or anything like that, temperature is not correct. And if that ever happens, then that is the student's responsibility to pay about half of that to just have the drug screen portion repeated. Immunizations and physical exams. So please reach out if you have questions about the immunizations. I will say like flu shot, hepatitis B, and COVID are all recommended for our program. We do currently have declination forms for hepatitis B and for flu. For COVID, we do not have a declination form, and we still have a couple hospitals who do require you to have it to go through the program or to come to to come to their hospital to do clinic. But the majority of the hospitals will accept a religious or a medical exemption. So if you have questions about that COVID vaccination, please reach out. Health insurance is a requirement also of our clinical sites, not something the college requires, but you have to have proof of health insurance to go to clinic. So even if it's just a temporary plan or something that is, just for a year or only covers emergencies, that's fine. We just have to have something saying you have health insurance. You do have to have a TB skin test, which can be done during your immunization and physical exam. Your physics exam in the second semester is $250, and in the fourth semester is $250 for your specialty exam. CPR through the American Red Cross, through the American Heart Association, it's about $60. So we have two different places that we recommend. Once you get into the program, we'll let you know about that. If you're not already CPR certified. You have an electronic clinical record. It is $98 per year. You will pay for that right before you start clinic, your 6th week of the program, and that will carry you through the entire program. Clinical travel, of course, it may be closer to you, it may be further away from you, depending on where you live. There may be other costs not listed here. Again, if you want a more thorough breakdown, please reach out and I can give you the breakdown that we provide the students. This is just how we factor tuition. So our semesters are either 12, 13, or 14 hours based on which semester you're in. So this is the total amount of tuition for 2023-2024 school year. I have one last video. Take off my pointer here. That's definitely my favorite video. Definitely kind of brings it home. But here's just contact information. Again, my information is right here. I'm Christy Flowers. Autumn Milburn is our clinical coordinator and also instructor for the program. So a little change for academic advising. So Artavia Littlejohn is the head of academic advising, but she will be out on leave for about 3 months. So Natasha Williams will be over the academic advising and doing the ranking for the programs. You can also request an advising center appointment at that email there, advisingcenter@augustatech.edu. But you can also reach out to Miss Williams. And if you reach out to Miss Littlejohn and she does not have an automatic reply already there, then she is still here. So you can also try that before she goes out on leave. So thank you so much for taking the time to listen. Make sure, again, if you're applying to the program, that you email me back answering the questions. And if you don't have those questions, please reach out to me, Christy Flowers, and get those questions so that you can have credit for attending the information session and be able to apply to the program. Thanks. Have a great day.